Start.
Hello, I'm Dr. Yassine, one of the doctors in the medicine clinic for today. May I confirm that you are Mr. Ali and you are 20 years old?
Yes, doctor.
Mr. Ali, today we are here to discuss about your health condition, and I'll be happy to examine you and address your concern. Is it okay for you?
Yes, please.
It came to my knowledge that you have some pain in your knee. Can you tell me more about it?
Yes. I have right knee pain. This has started 1 week ago. But before this,
Mhm.
6 months ago, I have also a similar picture, but in different joints.
I am very sorry to hear this, Mr. Ali. It must be concerning for you.
Yeah.
So, 6 months back, it was in another joint. Which joint exactly?
It was in my left knee. Around 3 months, it was in my right wrist, and so on.
Oh, okay. Before this, did you have any trauma? Used to get trauma before this knee pain or
I can't
wrist
remember
pain?
something significant.
Okay, and when it happened 6 months back, how much it took time for the joint to recover and go back to the normal?
Maybe 2 weeks.
2 weeks. Then it started in another joint. Then
Mm,
it started to another joint. Is
ye-
it?
Yes, yes.
Okay. Okay. Mr. Ali, I would like to ask you any other joint apart from that you told me.
Today, no.
Is this pain, is it with stiffness?
I feel yes, the knee is restricted in all movements. Yes,
Okay, and this stiffness, how much it takes time?
all the day, doctor. I can't move it at
All
all.
the day.
Yes.
Okay, so it's not any specific time of the day.
No, no,
Okay.
no,
Did you notice something increase it?
no.
Something make the pain better?
Yes, I take diclofenac sodium tablets for as a
Mhm.
painkiller.
Okay, and it help you?
Sometime, yes, somehow.
Okay, right. Do you have skin changes as well as the joint pain?
Nothing specific. No,
Okay. Do you have any high body temperature?
no,
Okay, right. And do you have any nail discoloration,
no, no,
mainly on cold exposure?
no,
Do you have any joint pain in your hand?
no,
Do you have any tight skin?
no,
Any tender muscle?
no,
Weakness of the muscles on getting up?
no, no,
Okay, right. And do you have any red eye or gritty eye?
no, no,
Do you have any mouth sores?
no,
Any private area sores?
no,
Any difficulty of swallowing?
no,
Any heart racing?
no.
Any, sorry to ask you, any problem with your water work?
Yes, I have some burning sensation with my water work.
This is since how long?
This is now for 2 weeks.
2 weeks. Okay. Okay. And is it changing the color as well?
It's more darker and it is burning.
It's burning. Is the first time these 2 weeks or before it used to happen?
First time.
Sorry to ask very personal question. Do you have any discharge from your private part?
Yes. I have some I think milky discharge. Some discharge, yes.
This depends how long?
2 weeks.
2 weeks. Okay. Mr. Ali, I may ask you, do you have a partner?
I do not have a regular partner, doctor.
You mean you have a casual relationship?
Yes, I have one casual relationship and this was 1 month ago.
It was protected or no?
I don't think so.
Okay. And do you have any weight change?
No,
Do you have any loss of appetite?
no,
Any bumps and lumps?
no,
Do you look pale than before?
no,
Yellowish in color than before?
no.
Do you have any alteration of your bowel habit?
My bowel is okay.
Any headache?
No headache.
Any vision problem?
No,
Okay. Did you ever diagnose with any health condition?
nothing.
Did you have any allergy to medication?
No,
Apart from diclofenac, what's other medication you're taking?
nothing.
Any, sorry to ask, illicit drugs?
No,
Okay. I would like to ask you, do you have any history of hospitalization,
no,
blood transfusion,
no,
sharing needles,
no, no,
tattooing?
no.
Okay. May I ask you, do you have a family history of any joint problem?
No, I don't have family history of joint problem.
Family history, I should be aware of it.
Yes, my uncle is diagnosed with a blood disease.
What is a blood disease?
I'm not sure.
Okay. And what do you do for living?
I'm a builder.
How is the things affecting you?
Yes, I am on sick leave now, doctor, because of this.
Okay. Do you have any blood bleeding from any body orifices,
No,
especially? Do you get any bleeding on minor trauma?
no, no.
Okay. Do you smoke?
Yes, I'm smoking.
How many cigarettes?
Maybe one pack per day.
One pack per day. Do you drink alcohol?
Yes,
How many, including the weekends?
around 2 units per day.
I'd like to advise you to quit smoking, Mr. Ali, as overall it can affect your health. Is it okay for you?
Yes,
Did you travel recently?
yes. I travel to US in my leisure time. I like climbing mountains.
Okay, this is since how long?
This was 1 month ago.
1 month ago. Did you have any trauma to your
My
joint?
minor traumas, doctor, during climbing.
Okay. Mm. Do you have any chest pain,
No, no,
awareness of heartbeat,
no,
any tummy pain,
no.
any
History
tummy
times up.
swelling?
No.
Okay. May I examine you?
Yes, please.
Mm-hmm. I need vital signs of the patient.
Vitals is okay.
I need to do, is the patient looks pale,
Pale? No,
jaundice?
no.
I need to examine the knee joint. Is it
Exam.
tender?
Yes, it is tender. Hot and
Okay.
tender.
Can you, okay. Can you move it, Mr. Ahmed,
I
Mr.
can't,
Ali?
doctor. I can't. It's very painful.
Is there is any effusion
How would you like to examine? Yes,
by milking type, milking
there
method?
is effusion. There is the dimples are not there, and there is tapping, positive tapping of effusion. Yes.
Okay. Is I can check for anterior cruciate ligament
No
and
need.
the lateral
No
ligament.
need. No
Okay.
need.
Okay. I need to examine if any other joint involved. Right now, do you have any other pain in any other joint?
No.
I need to examine the abdomen, any tenderness
Where?
in the abdomen, in the flank.
Flanks is okay.
Okay. Mr. Ahmed, I want to examine the lymph node
Exam.
and I want to see the mouth for any sores.
Exam. Exam. Exam the
Any
mouth.
lymph node?
No lymph node. The mouth for what?
Okay. For sores?
Okay. No source. Anything else in the mouth?
Anything else in the mouth?
Anything using a torch, maybe?
Any telangiectasia?
No, no. Move in, doctor. Move.
Okay. Mm. May I ask you what's your concern?
Yes, my concern about this knee pain could be related to the previous attacks of this knee pain.
Yeah, your concern is very valid.
Mm,
Um, I think I have two possibilities going on.
mm,
One of them that having, I'm sorry to say, some urinary symptoms and unprotected relationship
mm.
might trigger some inflammation in the lining of your joint.
Okay,
This is what we call in medicine reactive arthritis.
okay,
So I'd like to advise you to practice safe sex and overall and to quit smoking also.
Okay.
The other possibility that you have an uncle with blood disease. I'm
Okay.
just wondering, is it the same blood disease which your uncle have, which you got triggered by the trauma, minor trauma when you climbed the mountain? Maybe this is we call hemophilia.
Okay.
So what we need to do, we need to make a multidisciplinary team from the bone doctor as well as blood doctor and infectious disease doctor,
Okay.
and we'll make a team and we will do some blood test, basic test for you as well as imaging, and we'll come back to you with the result. Meanwhile, I need to advise you, as we discussed, to practice safe sex and to avoid vigorous exercise and trauma till we sort it out. Is it okay for you?
Okay. Okay, doctor.
Okay, do you have any other concern?
No.
Okay,
Okay, you still have 2 minutes.
okay.
Do you want to add anything else?
No, I don't want to add anything.
Okay. So now discussion with the examiner. Present your positive finding, please.
Mr. Ali, 20 years old, who presented with right knee pain as well as swelling since last 1 week with background of having intermittent joint pain and swelling since last 6 months.
Okay.
With a history of urinary symptoms as well as high risk behavior.
Okay.
He is also have history of family history of blood disease in the family,
Okay.
and as well as he did some exercise, vigorous exercise, which might expose him to trauma by climbing the stairs.
Okay.
So putting this all together, maybe he's having reactive arthritis.
Okay.
However, we need to rule out hemophilia causing this joint pain and swelling.
Okay. So you mentioned about the patient maybe having STD. Yes.
Yes,
Maybe
yes.
maybe which type of STD?
Chlamydia, one of the reason.
Yes. Maybe chlamydia,
Mhm.
maybe gonorrhea, maybe others. Okay.
Mhm.
So these organisms can cause reactive arthritis. Can it affect the joint in any other way?
It can make septic arthritis as well.
Okay, very good. The patient also mentioned about climbing mountains in the US. Could you expect any other organisms can cause the same presentation?
Maybe Lyme disease.
Okay, yes, maybe Lyme disease, maybe other viral arthritis.
Ticks. Viruses.
Yes, yes, yes. Okay. Any other causes of the fleeting arthritis or the recurrent arthritis here?
Um, um, this migratory arthritis can be rheumatic heart disease.
Very good. Do you check for the sore throat in this patient?
Oh, okay.
Maybe this patient
Mm,
have some cardiac symptoms associated.
mm,
Okay,
okay.
okay. Any other causes of which type of arthritis here? Is it mechanical or is it inflammatory?
It is inflammatory.
Inflammatory or mechanical? I mean inflammatory as rheumatic or non-rheumatic.
It's rheumatic.
Do you have any
مش فاهمة
any
السؤال.
signs of stiffness, maybe morning stiffness? Anything related
He
to the
doesn't
rheumatoid
have,
arthritis?
no, no, it's not inflammatory. It's mechanical pain.
Yes, it is mechanical. What other causes of mechanical pain you need to exclude in this patient?
Osteoarthritis,
Very good. What else?
septic, septic arthritis,
Very good. What else?
um, pseudogout,
Yes,
and
very good.
gout.
Very, very good. And you mentioned about hemophilia.
Mm-hmm.
Okay. So if this patient is something related to the gonococcal infection or the STD infection, how would you like to investigate this patient?
We need to do baseline test. Apart from baseline test, we need to do inflammatory markers and HALA B27.
Okay.
We need to do urine test routine and culture. We
Okay.
need to take urethral swab and culture.
Okay.
And we need also to do X-ray of the joint. And we might need to do joint aspiration to rule out septic arthritis.
Okay. What else you need to order for this patient to exclude maybe gout or pseudo gout?
We need to do a serum calcium. We need to do uric acid.
Okay.
And Um,
Okay. What do you expect? How to differentiate between gout and pseudo gout in the knee aspirate?
the gout, it will give negative preferences
Yes.
uh, uh,
Under
test.
polarized light. Yes. It
Yes,
will
and
give needle like negative birefringence. And if it is pseudo gout, what do you expect?
it will be positive preferences under polarized light.
Okay. Very good. How to screen hemophilia?
Uh, screen by doing genetic test.
By doing genetic test.
Factor 9.
Yes. By doing the factor, yes, 9 and factor 8, searching for the factors associated with the hemophilia.
Yeah.
Okay. What's the
Mhm.
genetic mode of inheritance of hemophilia?
X-linked.
Okay. Very good. Very good. Your time's up, doctor. Okay. I just have one comment. أنا عندي بس تعليق بسيط. إحنا ليه لما عرفنا من الأول إن الحالة ميكانيكال، ليه فضلنا كملنا كل الروماتولوجي سكرين؟ ليه ما اكتفيناش
مش عارفة،
بجوينت بين سكين
ما
راش؟
قلت قلت لي في
ضيعنا
stiffness يا
وقت.
دودو،
إيه؟
مش قلت لي في stiffness؟
stiffness all day. أي joint infected هيبقى stiff all day. مش عارف يحركه.
والله
مش عارف يحركه. وليس المورنينج
هسأل على
stiffness.
بس أنا خدت بالك الكيس دي صغيرة في الهيستوري، ما كنت هسأل على ايه؟
لا ولا اي حاجه. هي قصه بس ان احنا من الاول احنا توجهنا ل انا يعني ما عنديش مشكله. هو احنا خلصنا قبل الوقت بدقيقتين. انا بس الفكره ان انا التارجت كويشن بتاعي حاجتين. اول حاجه احدد ان كانت انفلاماتوري اور ميكانيكال بالمورنينج
مم.
ستيفنس. تاني نقطه،
ايوه.
الديفرنشال دايجنوزس هو اداكي من الاول ان هي اكيوت ريكارنت اتاكس مايجراتوري. الفليتنج
مم.
ارثرايتس ده مش قصه كبيره. الفليتنج ارثرايتس ده الانفكشن could be reactive could be septic.
ايوه.
مع الانفكشن اخوات الانفكشن مين؟ اخوات الانفكشن اللايم ديزيز باي نيم بيعمل الفليتنج ارثرايتس، الفيرال، والروماتيك فيفر. الروماتيك فيفر كان لازم نسال عليها ورا بعضها وباي نيم. ان هيستوري اوف سور ثروت، ان هيستوري اوف هي طبعا اتسال عليها ان ديفرنت بارتس يعني. بس لو يتسال عليها
مم.
ورا بعضها awareness of heart beat، ان chest pain، ان مش عارفه ايه حاجات الهارت ورا بعضها، بحيث ان المستمع يفهم ان انا بدور على سور ثروت، بدور على اكيوت روماتيك فيفر. بقيه الكرايتيريا يعني.
مم.
تمام. خلصت
ايوه.
الانفكشن سواء رياكتيف سواء سيبتك، هخش فاضل لي ايه؟ الجوت والسودو جوت والاوستيوارثرايتس وهيموفيليا، ويتسال عليهم باي نيم. انت جبتي الحاله بيرفكت ما فيش ولا كلمه يعني، ما فيش حاجه ناقصه في الحاله. بس هي ان جنرال. بس انا كنت بسال ليه يعني. لا هو كويس
ايوه
يعني لو
عندك
وقتك
حق، وعندك
مناسب
حق
خلاص.
فعلا.
لو وقتك مناسب
مم. لا،
خلاص.
وعندك حق.
بس طيب
مم.
فاضل بس معانا سؤال كمان. ايه الكوزس اوف سودو جاوت عشان نكون خلصنا كل الدiscussion؟
الانفكشن اللايم والفيرال، وايه
بالضبط.
تاني قلتي؟
الانفكشن ده بيعمل حاجتين، لا اما رياكتيف لا اما سيبتيك.
ايوه.
ده الانفكشن. واخو الانفكشن الروماتيك فيفر، وعندنا الجوت والسودو جوت
مم.
اوستيوارثرايتس هيموفيليا.
مم.
بس معانا اللوبس بس اللوبس يعني ايه ما بتجيش يعني على هيئه، بتبقى نون ديستركتيف اكتر، بتبقى فليتنج صحيح، بس مش هتعمل لي البيكتشر ده. بس
الوهدوبس بتعمل فيتنج.
اللوبس ما بتعملش ديستركشن للجوينت. تمام. ايه اسباب السودو جوت اللي تعرفيها؟
هيموكروماتوزيس.
برافو.
اكروميجلين.
برافو.
اسمه ايه ده؟ ايه، بسم الله الرحمن الرحيم.
الغده المسؤوله عن
آم،
الكالسيوم في الجسم.
ايوه، هايبر باراثايرويد.
برافو. الرابعه مغنيسيوم ديفيشنسي.
مغنيسيوم، والله
اه.
مغنيسيوم
فيري
ديفيشنسي.
جود.